Hi, my name is Jack, and I'm one of the first year grads doing my education year in Ryde Hospital. I'm here to answer some of the questions that you may have if you would like to work at Ryde Hospital.
Hi, I'm Pat. I'm one of the first year grads at Ryde Hospital, and I'm here to answer a couple of questions for you guys.
Hi, Jack. So what are the rotations and secondments that first year grads can expect at Ryde Hospital?
So there are no secondments in Ryde Hospital. There are also no on-calls or night shifts for physiotherapists working in Ryde Hospital. And rotations in Ryde Hospital includes 10 weeks of HDU, which involves ICU care as well as cardiac conditions, 10 weeks in Ward 3, which are a general orthopedic and general surgery ward, 10 weeks in Ward 7, which are a general medical ward, which can include patients that have come in with falls or COPD. And on the rehab side of things, we have 5 weeks of rotation in GR4, which for general reconditioning conditions such as hip fractures, knee replacements, and COPD. 5 weeks in GR5, where they focus on neurological conditions such as stroke, Parkinson's disease. They are also specialized in amputees and burns. And we also have a 10 weeks rotation in outpatient physiotherapy, where we can expect to have experience in running joint replacement program classes, cardiac rehab classes, pulmonary rehab classes.
So Jack, can you tell us a bit about the working hours, including weekends at Ryde Hospital?
Yep, the working hours are standard 8 to 4:30 p.m. with an hour break from 12 to 1 p.m. Weekends are only from 8 to 12 a.m. to 12 p.m. for both days.
So Jack, can you tell us a bit about what professional development and education opportunities you can have at Ryde?
Yep, so for first year grads, we have the amazing opportunity to participate in Mackenzie's Part A and Part B course. Each of the course costs about $900, and the physio department is very kind to reimburse us with 2 of the courses. And on a regular basis, we have regular in-services and regular general clubs on Wednesday for our continual professional development. And because we are a small hospital, we also have the opportunity to attend professional development courses that are usually for more senior staff, such as cardiac rehab, professional development, and stuff like that. So Pat, what are some of the support programs and mentorship in Ryde Hospital?
Yeah, so each first year grad is buddied up with a senior physiotherapist as their peer support and clinical supervisor for the year. So you meet with them once a month. So normally a level 1-2 would meet once every 3 months, but here at Ryde, we get ongoing professional development as first year grads. So we meet once a month, and you can approach them at any point if you have any questions. We also work as a very close team, as we're such a small hospital. So it's very easy for us to ask any questions that we have to any of the senior staff, and we'd always be buddied up with the senior staff on our rotations. We're also lucky enough to have a number of different specialist therapists. So if you have a certain passion for amputees, we have physios who specialize in amputee physiotherapy, or if you have a passion for burns or women's health, we also have seniors that specialize in those areas. So at any point, we've been able to ask them any questions we have. In terms of mentorship as well, we can meet with our clinical supervisors or our seniors or head of departments at any point to discuss if we're meeting our pride goals, which is, career goals for us and where we want to be in the next year, so they can help steer us in that direction and provide any opportunities that we need to get there.
So Pat, what are some of the other aspects of working in Ryde Hospital, such as social events, other opportunities, or highlights, etc.?
Yeah, so I think a huge highlight of Ryde Hospital is every Friday in your acute rotation, you get to experience fracture clinic. So it's from the whole afternoon. You get to be doing cast, removal of cast, talking with the orthopedic surgeons, providing exercises. So it's a unique opportunity that we get at Ryde, because most departments only limit 3 physios, but we provide our whole acute department. Some other highlights are that Ryde, again, as I said, is a small team, so we get to have lunch together every day as a team. We're not isolated as first year grads, and often almost once a week we will buy some sort of takeout food to celebrate any excuse. So the food is really good and the team is really friendly, so it makes for a great outing and good social experience. And I guess otherwise, we put on multiple events, so we're looking to organise, I guess, walking groups together, or we can catch up and watch movies together on the weekends, or even Friday after work we go for some drinks and some Korean fried chicken at Eastwood. So yeah, there's ample opportunity to get involved in such a great team and to just really be part of the team.